Moving on, sorry, moving on to the next slide, we have drugs that are known as enteral medications. These are any medications that are given directly into the GI tract. So these are medications that are swallowed. They are medications that are inserted rectally that are meant to go systemic, and they are medications that are given through some sort of a NG tube or a PEG tube. Nasogastric tubes are temporary. A PEG tube is going to be permanent, intended for feeding and or medication administration. On page 41, you will see advantages of PO meds, and you'll also see disadvantages of PO meds. You want to learn those, you will see those again. There are some lifespan considerations when it comes to every medication, and if you look on page 42, you'll see an example of a box that talks about lifespan considerations. They're always going to be in green, and they will either give you information about pediatric considerations or geriatric considerations. Safety tips are shown in a couple of different ways. Many times they're purple if it's just a brief tip for safety, and sometimes they'll be in red. Always read those, always take note of the information. Liquid medications, like I said, all have to be taken thoroughly, and you don't want to dilute them unless that's part of the instructions. We're going to talk about nasogastric tubes or PEG tubes, but the most important thing to remember before you administer any medication per tube is to check the placement. Definitely with nasogastric tubes, because they can migrate up beyond the nares, and they can introduce liquid into one lung or another. And so it's very important that placement is checked. A PEG tube or another permanent tube into the wall of the abdomen is not as likely to migrate, but you still want to make sure you check placement. Best practice is to make sure placement is checked. You don't want the patient to end up with some sort of pneumonia. You have not had it in the notes that you've checked placement of the feeding tube, and then I might try to blame it on you for not administering the medications properly. Always think about covering your tail end. This is just a picture that you can look at on your own slides, but it shows how a PEG tube will fit through the wall of the abdomen and into the stomach. Usually it has at least one port and either a stopper or a balloon to keep it inside the stomach. This is inserted via a puncture wound into the stomach, usually often by a nurse, while the doctor is looking through a scope down into the stomach and guiding the placement. So usually it doesn't take very long, a special procedure, but this is a way of giving food and medicines indefinitely. Here's a nasogastric tube, and I don't know that you'll really have a chance to practice putting these down during clinicals. They're not hugely common, but basically any kind of nasogastric tube is a tube that goes in through the nostrils, goes down the esophagus. It does not, remember the nasopharynx and the oropharynx all meet at the back of what we call our throat, but a tube can go down through the nares and still make it into the esophagus. You don't want to go into the trachea. You want to go in the esophagus, and the end of the tube should go in the stomach. These are usually temporary because you can't indefinitely feed or administer medications through a nasogastric tube too hard on the mucous membranes of the nose and mouth. Eventually a decision is going to have to be made if the person is still going to need tube feeding. These are more temporary measures, both to empty the abdomen of any contents after surgery and if you need gut rest, or to administer meds to somebody who cannot take them orally for whatever reason. This is a picture of something called a JG tube. It's got 2 ports and 2 tubes. The G tube ends in the stomach, the J tube ends in the jejunum, which is the second section of the small intestine. When it comes to administering medication, you could have a big plastic NG tube or what's known as a Dobhoff tube, which is a little skinny flexible tube down the nose into the stomach. We got PEG tubes, J tubes, JG tubes, all kinds. Medication forms are going to be liquid. That's the easiest if it's already liquefied. With pills, as long as they're not extended release or enteric coated, they can be crushed and you add water to administer the drugs through the tube. And we'll practice that in my MedPass clinical. We will practice doing some tube administration of meds. And like I said, a lot of what you do is going to depend on your facility protocol. For example, potassium administered through the tube is not supposed to be crushed, but some places will allow you to crush potassium and then dilute it thoroughly before giving it through the tube. You just have to know the facility's policies. When in doubt, don't do it until you check and make sure that in the policy and procedure manual, it is okay to crush that particular potassium and dilute it with water. Now, let's see, got my textbook here.